All right, so today we're talking about shoulder injuries or shoulder pain. The first thing we have to start with is stabilizing the shoulder. If it's weak and you start exercising, you could potentially cause more damage. These videos are here for my patients. A lot of times I teach in the office. This gives you an opportunity to review it, watch it, and understand it. So in the shoulder, when it sits up in the glenohumeral joint, if there's motion in it, we kind of beat up that joint a little bit. If we can stabilize it, it will move a lot better and be a stronger joint. So today we're going to talk about how to stabilize that shoulder and make it a stronger joint so that we can handle the exercises. To do this, you're going to need a kettlebell. You can pick these up about anywhere. I would not get the cement ones. You drop them, they're gone. I would get a solid steel kettlebell. This one's 15 pounds, and that's probably about as heavy as I would get. If you're a big, huge bodybuilder, you're benching 300 pounds, maybe we'd be getting into a 20 or 25, but 15's plenty. If the 15's too heavy, obviously go down to the 10 or the 5. We're gonna move over here on the floor and show you how this is done. All right, so for this, you can just find a spot on the floor. If you have a bench at home, you're more than welcome to lay on the bench. You're gonna take your weight, come down on the floor with it, use both hands to control that so we're not injuring the shoulder. I'm going to get that with both hands and I'm going to raise that straight up. I want this kettlebell to be out on the edge of my arm. That's going to create a weight like it's pulling it away. I'm going to put the arm so it's straight up. I have some pictures that will show you. I want to keep it in line with my shoulders, in line with the side of my body. That's right, in line with the side of my body. We're not going to be counterbalancing in here. Don't want you up there. Don't want you down here. That arm is straight up. Your shoulder is going to stay relaxed and back on the floor, not pushing up like this either. Once we get to this position, we're going to lay there and keep these 4 fingers right in line with the side of my body. So I'm looking to watch all 4 of those. My goal is to hold this for 3 to 5 minutes. That's a long time. You'll start to get a lot of heat in your shoulder, or you might start shaking. At that point, we bring it down. Even if you have a good shoulder, go to the other side, bring it up, give this one a rest while you're working the good one. It'll be a lot easier to do, but hold that for a couple of minutes. Bring it down, go back and work the affected side. Both of them need to be strong. Things that you're going to look for is the wrist falling back or your hand rotating. While you're doing this, keep your other hand right here. When I learned this, the instructor said he had someone drop one of those once and it landed on his face. I don't want you to go to the point of that kind of fatigue. So just have it here in case that comes down and you have something to deflect it with. Again, control it with both arms. Hold it straight up in the air and that's it. We just hold it. That was gonna take and strengthen that rotator cuff. Gripping this will hold it. There's one modification. Once you get to where you can do this and you can hold it for 3+ minutes, then you can go ahead and take that kettlebell and just put it up on an angle. Same thing applies, straight down the side of my body, right across my shoulders, but that's just gonna be out a little bit. I just have to increase my grip to hold that up there. And I'm probably gonna do that for about 1 to 1.5 minutes, and that's a full exercise. Thank you. Okay, so that's the end of the stabilization for the shoulder. If you have any questions, call down to the office, let's make an appointment and we'll go over those with you. I hope you get strong. It should take you about 4 to 6 weeks to notice a difference. Call us soon.